Well, hello, I'm Dr. Sherman Silber, Silber Infertility Center in St. Louis, Missouri, and we're going to do Facebook Live again. And during this Facebook Live, I'm going to answer any questions that you might have about fertility, reproduction. It's your chance to really get anything that's confusing you answered, and I love doing this. And I'd like to just start out by saying a few things. We have actually, very excitingly, got a new program. We're doing ovary transplants uh, between non identical sisters or cousins, and it's particularly useful for Turner's syndrome. And that's where the girl is born with no eggs and she only has one X chromosome. And it's terrible because they know from the beginning they're going to have to be on hormones just to be normal, but also they're just not going to be able to have children, and unless they use donor eggs, it's a big deal. But with ovary transplant now, by using the immunosuppression program that was started here at Barnes Hospital and at Johns Hopkins that we collaborate with, it's a very safe protocol. It's not really dangerous, and it's not like for a kidney or a heart transplant. It works so beautifully for kidney transplants that we're using it now for non-life-saving procedures. So we have successfully presented at the meeting in Europe just a couple of months ago, and we're going to be presenting it at the American Society of Reproductive Medicine next month. That we've had 4 cases already of transplanting ovary from a sister or a cousin to her sister that has no eggs, whether from a Turner syndrome or whether from just getting older and running out of eggs. And so it's pretty exciting. I'll talk about that. And then I'd like to mention that our new lab has been working since late January, and it is fantastic. I call it a 22nd century lab. And we really have an amazing culture system. So the embryos are very, very, very safe. And so, and with using our minimal stimulation mini IVF protocol, we get really fantastic quality eggs, and they stay fantastic quality. And it's a culture system where every embryo has its own little tiny chamber. You don't have everything in one big box incubator. So the conditions of pH, acidity, and humidity and temperature stay constant all the time. It's individualized for each single patient. So all these advances in IVF are making it much safer and much more productive. And we're dealing with patients whose eggs are older and older and older, and yet we're getting reasonable results and fantastic results in women who are not have not really reached that older age where it's more of a challenge. So it's just a little bit of introduction. We're very excited about our new lab. I think it's incredible. It's in a beautiful neighborhood, and we have a great facility. It's very comfortable, and uh, and I'm thrilled. And many IVF people are doing the same thing now, improving the quality of IVF. And but the ovary transplant is brand new, and I had to bring that up because that's exciting, and we're getting more and more interest in that from actually from young girls who have no ovaries or born without any ovaries. So I don't know. Do we have any questions now coming in that I can start answering?
So your first question is going to be which IVF is best for a 40-year-old?
Okay, well, that's a good question because one of the reasons why infertility is such an epidemic that everybody's talking about everywhere in the world is that we're putting off childbearing because life is so different. We figure we'll live to 100, and there's so many opportunities when you're younger. Many couples, many women just don't think about having a baby till they're 40. But by then, the vast majority are infertile. So what happens is that two things happen as the woman gets older. The number of eggs goes down, but also the fertility of each egg goes down. So it's a double whammy. The eggs themselves aren't as fertile, and we have less of them. So certainly, when a woman is 40 years old, the ideal approach is mini IVF. And I can answer it. First place, the intuitive response of many doctors is, well, she's that old, she doesn't have that many eggs. We'll bomb her with a huge dose of these hormones so that we'll get more eggs and better eggs. And that's the opposite of the truth, because with that huge dose of hormones, FSH and LH, and a gigantic overdose, you actually hurt the eggs. We have 4 to 5 times higher baby rate per egg with a much more minimal stimulation. And the other thing is the value of just preceding the IVF procedure with birth control pills to kill off all the bad quality eggs that have been accumulating in every woman's ovary. And particularly if you're 40 or older, you can't afford that. And so there's other aspects to it, but with this mini IVF approach, which I certainly recommend for any 40-year-old, we really get better quality eggs. Now, if you're 25, it almost doesn't matter what you do because there's so many good eggs. But mini IVF is better even for the younger woman with lots of eggs. At any given age you want to analyze it, at any specific age, the baby rate per egg is 4 to 5 times higher with this protocol. Dramatic difference. So when you're talking about women 40 or 41 or 42 or older, you really can't afford to be ruining the eggs with a more conventional protocol. So I would recommend highly the mini IVF. We always get the best quality eggs that way. And when we have new embryologists that have never been in our lab, but in other labs, they all say, oh my gosh, these eggs look so fantastic. There's better membrane elasticity, better cytoplasm. They can just see it. It's not just the result, but they can see it when they're handling the eggs. So that's my answer to you, mini IVF for 40-year-olds.
Okay, Dr. Silber, your next question is, what tests do you recommend?
Well, I think that you can do this very simply, or you can overdo it and spend a fortune. Better to do it very simply. So obviously for the male, the sperm count is still important. It includes the motility of the sperm and the structure of the sperm, called morphology, and the number of sperm. That is really, I mean, there are a lot of modern attempts at tests like DNA sperm fragmentation and the old hamster test. I mean, there are so many different kinds of testing that are worthless, and they just cost a lot more money. So you need the sperm count. Now, if we're going to do IVF, we don't care what the sperm count is as long as there's any sperm at all, because we pick the sperm up by the tail and inject it directly into the egg. And you don't need 100 million or 50 million or 10 million or 10,000 or 100 or even 20 sperm. All you need is a few sperm. It's amazing. And we first did that in 1992. And so our experience is enormous with it. And we just don't care what the sperm count is as long as there's any sperm whatsoever. And even if there's no sperm, we can always do a micro procedure on the testes, and 60% of the time find a few sperm there, which are all we need, again, for this technique of injecting the sperm into the egg, which we call ICSI. Now, as far as the female is concerned, the most important thing is her age. That is the one most important indication of the fertility of her eggs, is just her age. And then, of course, you want to do an AMH and an ultrasound so you have an idea how many eggs she has. That's important to some degree because the major cause of infertility, this huge increase, is that as the ovary gets older, the number of eggs goes down and the baby rate per egg goes down. And so the most important thing for the woman is to find out what her ovarian reserve is with either an antral follicle count on ultrasound or an AMH level or both. The next thing that's really important is just her menstrual history. If you're really a smart clinician, you can make a diagnosis on menstrual history. If she has totally irregular cycles that can vary from 20 days to 45 days apart or twice a year, well, you know that she's got PCOS. In other words, so many eggs that they inhibit the pituitary gland She never ovulates and never recruits a dominant follicle. And you know whether that's the case just by the history, actually, is all you need. So I'm making this very simplistic because you could spend $10,000 to $20,000 on tests that aren't really necessary. And so ultrasound usually will tell you what you need to know about the structure of the uterus and the fallopian tubes, vagina. However, sometimes you need to do what we call a hysterocell pentagram to see whether the tubes are either blocked or whether they're dilated. And so the history, but the hysterocell pentagram is about $1,000 and it's painful. So if we can get around that, just with a three-dimensional high-definition ultrasound, then we'd rather do that than put you through the hysterocell pentagram. But sometimes you need the hysterocell pentagram. So I've mentioned it. I mean, there was, when we were in Paris just in May, and I delivered my talk about ovary transplantation, which I mentioned earlier. There was one fantastic talk by a European showing that with ultrasound, and just injecting fluid, but fluid with bubbles in it, you can see not just the uterus, but you can actually see the fallopian tubes very clearly. So, and you can do an antifollicle count to know the ovarian reserve. So this doctor was making the point that you can get by with just one test on the woman to know what you need to know before treatment or recommendations. So I'd keep it simple and not waste a lot of money on too much testing.
Okay, Dr. Silber, I have a two-part question right here. The first part is, I have PCOS at 45. I've had 30 eggs, of which 18 were good, 7 embryos, but was told they were not good genetically. And then she also asks, what is the best way to achieve pregnancy?
Well, it's again, with 45-year-old, it's very, very challenging eggs because the baby rate per egg is always going to be low. And with PCOS, though, she was born with such an excess of eggs, because that's the cause of PCOS, that she has more eggs than most women, in their 20s are going to have. And she had that. And they thought, I guess, from what I'm reading, her question, that 18 of the eggs were mature and 7 embryos resulted. But when they did a biopsy and tested them for counting chromosomes, they all had abnormal numbers of chromosomes. So it was predicted that they, wouldn't result in a pregnancy. But let me point out, 30 eggs, of which 18 were good. That's crazy. With minimal stimulation, you might get 12 eggs, and they're all gems, and they're all good. And then you're more likely to get embryos that will result in a baby. But it's a challenge for 45-year-old eggs. But I would do several cycles until we finally find one that is genetically normal, or that has a normal chromosome number. You can't test all the genes, that's silly, but you can count chromosomes. So I would recommend several cycles of mini IVF to see if we can get better eggs. But I'm not going to make any promises because 45-year-old eggs will always have a low success rate. But if it doesn't succeed, then you can go to donor eggs. With donor eggs, you should have like a 95 or more % chance of having at least one baby. So donor eggs is an interesting subject. It sounds very, very spooky. But if you can't get pregnant with your own eggs, we've never had an unhappy cases with people that resorted to donor eggs. That's since 1986. We've never had an unhappy case. And that's because you can always match for a 20-year-old that has your appearance and background. That's easy to do. Many, many young women are ready to donate. And it's anonymous, so you don't know them, they don't know you. But there are 5 things you really care about in the baby. All women should care about this, all men. Personality, character, intelligence, emotional stability, and bonding with you as mother. But those 5 things are intangible and they're not in the DNA. I guarantee you they are not in the DNA. They arise very early in life from how you interact with the baby in the first 2 or 3 years of life. So all of our people that had to resort to donor eggs are happy. It's their baby. And sometimes I tease them. We get Christmas cards all the time, and I say, "Well, I know you're very proud of your child just graduating from medical school, but you realize it's not your DNA." And they laugh. They say, "Doctor, I don't care if it's my DNA. It's my baby. It's my baby in every way." So if you can't get pregnant with your own eggs, which is everybody's preference, then donor eggs is a good option. Certainly a secondary option, but a good option.
Okay, Dr. Silber, the next question is, how do I know if I have PCOS?
Well, that's a good question because, I mean, one way is to get an AMH level, another way is a antral follicle count ultrasound, but that's not really as definitive as the fact that you have irregular cycles or that on ovulation kits you ovulate late in the cycle. Not on day 14, but more like day 18 or day 20 or day 25. Uh, you can tell just by the menstrual history whether you're like a 24-year-old woman should have fantastic eggs. She should be able to get pregnant very easily. But if she's been trying to get pregnant and her husband's sperm count is normal and it's been going on for a couple of years and she has irregular cycles, like maybe some months 25 days apart, other months 60 days apart, maybe twice a year or maybe 6 times a year, all these kinds of irregular cycles that clinches the diagnosis as PCOS. And when we have that kind of a history, even without an ultrasound and without an AMH level, I can promise that woman that she has a huge excess of eggs, too many eggs she was born with, that's inhibiting the pituitary gland so that when she has her menstrual cycle, you don't get that sudden rise of pituitary hormones that would recruit a dominant follicle. So she never recruits a dominant follicle and never goes into that normal cyclic 28-day cycle. So it's very easy to diagnose PCOS.
Okay, your next question, Dr. Silber, is what is the cost for donor eggs?
Well, the cost can vary for donor eggs. So it's a bit expensive, and it depends. Now, there are donor egg banks that will actually send to the IVF center maybe 6 eggs from a young donor. And that would cost her a lot, like $15,000. I'm not sure that's the right way to go because these donor egg banks will overstimulate. So they get maybe 40 eggs from a 22-year-old, and then they divide it up 4 or 5 or 6 ways to other recipients. And so, I said when you overstimulate, the vast majority of the eggs are no good. So you just don't know when you get 6 of those eggs whether you got the good ones or the bad ones. You really don't know. So it's less expensive. If you go with a fresh donor, anonymous donor, it'll be somewhat more expensive, but in the long run, probably a better way to go and cheaper because the baby rate's going to be so much higher because you'll have more eggs. So that's about what the cost is. It's a lot, but often people that need donor eggs are in their 40s or 50s. They've saved up money over their lifetime and they can afford it. I wish it weren't so expensive. For the doctor, it's not that expensive. Just for getting the donor, it's expensive.
Okay, your next question is, can taking testosterone affect fertility?
Oh my gosh, that's like throwing me a soft pitch. It's a disaster. So many men are going on testosterone now. It's the fad, it's the latest because it will make you stronger and it's easily available. You can put it on your skin, you can give yourself a shot at, and so many doctors, there's men's health clinics, and they give them testosterone. They hand it out like candy. And it does make you feel stronger and more alert. There's no question about it. Improves your sex drive. However, it inhibits your pituitary gland secretion of FSH and LH. So your testicles that would have been that size shrink up and get small, and you're not making sperm at all because you need those hormones for your testicle to make sperm. In the absence of those hormones, your testicle just, in a sense, dries up. You wouldn't, I can't tell you how many patients come to us and for infertility, and they don't know this. The doctor who gave them their testosterone doesn't tell them about it. And when I tell them, oh my gosh, your testosterone's causing you to have no sperm, they're just surprised and shocked, and they love being on the testosterone. So we make them go off the testosterone, and usually the sperm count will return to normal in anywhere from 3 to 8 months. And then when it returns to normal, it may be they'll just get pregnant naturally, or you might have to do IVF involving injecting the sperm into the egg. But in most cases, men will recover from this. But what if the wife is 39 years old and you're in a hurry to do the IVF? Well, you're not going to be able to do it if he has no sperm. So you have to wait till he has sperm. You could, of course, freeze her eggs, but most couples would rather wait till there's sperm and get the embryos. So yes, testosterone will definitely make you sterile.
Okay, and I guess the second part of that question too is, what is the best way to increase sperm count?
Okay, well, no hormones and no drugs will increase sperm count. There are urologists that will put the patient on Clomid, increasing their FSH and LH secretion. And that may increase his testosterone level, but it will not increase the sperm count. There is nothing you can give that will increase the sperm count. It's not like stimulating a wife to get more eggs. The amount of sperm is related simply to the number of spermatogenic stem cells, and that's fixed, and that's genetically controlled. And there's a variety of genes that control the sperm count, but it's all genetically controlled. And there is nothing that can really change it for the better. Now, you can reduce the sperm count or put it down to zero just by going on hormones like testosterone. You can really mess up your sperm count, but you can't increase it.
Okay, here's a kind of a long question here.
Wow.
I'm 32 with 3 kids, would love to have one more. So I was thinking IVF, my tubes are tied. I had them tied 22 during my 3rd C-section because my first pregnancy at 18, I had preeclampsia. And then with the last, I had gestational diabetes. So my husband was terrified of losing me and insisted on my tubes being tied. So my question is, would that disqualify me from IVF since I've had rough pregnancies, or would any health problems prevent IVF?
Well, you mentioned gestational diabetes that can usually be managed, but preeclampsia is really terrifying. And you just don't want to have preeclampsia. That is very scary. But you know what? I mean, we can do mini IVF or IVF and freeze your embryos and then transfer them to a gestational surrogate. Now, you may find your own gestational surrogate. It might be your mother or your sister or a good friend or a cousin, and then it's really inexpensive. On the other hand, if you don't have anyone that would be willing to do this as a love gift for you and carry your baby, agencies will find you gestational surrogates. It's just that becomes expensive, very expensive. Gestational surrogate could cost anywhere from $40,000 to $80,000. So it's always available, but I think most people would find it easier and more manageable if they can just find a friend or a relative that's willing to carry the baby for them. But you don't have to carry the baby, and you don't want to take the risk of having preeclampsia again.
Okay, your next question, Dr. Silber, is, are there a lot of injections for mini IVF?
Very few injections. There'll be an injection basically every other day, and it's very, very little injections. But the injections you get, even if you have more injections nowadays, the needle is like what we call a diabetic needle. It is so tiny, you don't even feel it going in. And you can inject it anywhere in your body because as long as it's under the skin, it'll be absorbed. And not many injections at all with many IVF, but you shouldn't be afraid of the injections. And some people need more than others, but you shouldn't be afraid of the injections. Now, when we transfer the embryo back to you, you'll have a choice. You can have progesterone injections every day, And many in the United States, most women prefer that. Or you can do suppositories of progesterone. And I found that to really have a good result, you need a double dose 3 times a day of those suppositories. So many women would just prefer one shot every day. But it'll be up to you how you want to do that. But it's very easy to go through. It's much more pleasant than massive overdose with hormones.
Okay, Dr. Silber, then the next question is, do you have a cutoff age for mini IVF?
Well, no, we don't really have a cutoff age, but we counsel couples on what are their chances for success. So, like if you're 40 years old, it's a lower success rate per embryo. But if we have the equivalent, say, of 2 blastocysts or 6-day threes, depending on how you go for it, you will have about a 60% chance of at least one baby. Now, when you get to something like 45, the success rate goes down dramatically. With the same number of embryos, you might have a 15% chance of success. And when you're 47, it'd be very, very, very low, but it would be possible. Uh, so most women want to try with their own eggs, even if they're older, and so we don't have a cutoff. If you insist, we'll do it with your 48 or 49 or 50, because who knows? There's always a 1 in a million chance. And most women want to try with their own eggs. If it doesn't work, then most women will be usually willing to go to donor eggs. But they've got to see if it's possible with their own eggs. So we don't think a cutoff makes sense. It really, every patient, every person is individual.
Okay, Dr. Silber, your next question is, if someone is 47 and not have periods for 6 months, the best bet is to go for donor eggs? I guess that's the question.
Yeah, I think that's really true because you're probably going through early menopause, and we would put you on hormone replacement. And donor eggs is your best bet, really, because if particularly if it's a fresh donor and you get 3 blastocysts, that adds up to over a 95% chance of at least one baby. So, and I'm not uh, most women want their own DNA, but if you can't have your own DNA, I don't know anybody who's been unhappy using donor eggs.
Okay, Dr. Silber, your last question for this evening is, will I have twins if 2 embryos are transferred?
Well, that's a very good question. Not necessarily. You might have a 30% chance of twins, 35 or 40% chance of twins, depending on the quality of the embryos and your age. But it's not 100% for sure. Now, a lot of doctors really are against twins because it's a higher risk of preterm labor, a higher risk of low birth weight infants, and it can, it can be a problem pregnancy. But with modern OB high risk care and NICUs, it's just amazing. These kids all do well. There are 2 advantages to transferring 2 embryos. One is you reduce your cost because it takes half as many transfers to result in the baby. The other advantage a lot of people don't talk about, but we've seen it very, very clearly. There is no closer relationship on the planet Earth than one twin has for another twin. Not identical necessarily, but non-identical siblings, twins. They just have an intense relationship. It's closer than mother and father for their whole life. It's a great, great gift to a child to have a twin sibling. So I think that's an advantage I hear no one talk about, and so people might like that advantage. We're willing to transfer too.
Okay. That was your last question for this evening, then, Dr. Silber.
I didn't hear that. What?
That was your last question for this evening, then.
Yeah, because time is pretty much up. It's been a half an hour. So I just want to close by saying I'm always available. I love talking to the patients, and all you have to do is go to our website or call us up, and you'll make a free Zoom appointment, no charge. And I like the most difficult cases, and I'm happy to talk to everyone. And of course, I'd be your doctor, so it would be completely confidential. So this is nice to be able to answer these questions over the air to thousands and hundreds of thousands of patients at one time, people at one time. But I'm also happy to do one-on-one Zoom consults with you. I love what I'm doing, and that's why I don't plan on retiring. So this is Dr. Sherman Silber from the Silber Infertility Clinic in St. Louis. And we're going to sign off now, and I'll see you again next month.